Good morning. To start off, can you please give us a short summary of your profession and your role or involvement in the pandemic?
So I'm a pediatrician. I'm working in a rural setup in upstate New York. The town is called Wellsville, New York, and I'm a general pediatrician over here in Wellsville. And so my title is MD. And fortunately, because in pediatrics we haven't had so much of coronavirus, and this being a small town, I haven't really, had to deal with too many kids, sick kids.
I'm aware that you and your husband share the same job at the same hospital. Would you say that sharing those aspects of your life has helped you or hurt you during the pandemic?
I would say it has definitely helped me. In general, working together, as a couple has it's been a blessing in its way. And with pandemic, it has been since we look out for each other just to make sure that each one of us is following the precautions, the safety precautions, and uh, yeah. So I think it has helped to work together.
So he's kind of like your support system,
He is.
like
He
with
is.
everything.
Yeah, he is.
So, in addition to an already present toddler, I believe you had twins a month or so before COVID hit, right?
Yes.
So, safety procedures did you have to take to protect yourself and your family?
Uh, so, uh, so the following with all the well child visits that they had, the offices where we went, they were practicing social distancing, and then hand washing, using sanitizer, and we just avoided all non-essential visits to the doctors at that point. And at home, we would frequently wash our hands with just soap and water. Because there have been some reports where excessive use of hand sanitizers has shown to cause some, harm to newborns. So we just like would just wash our hands, and then when our toddler would come back from daycare or from playing outside, we would make sure she was clean properly before she would touch the babies.
the the kids they went to the daycare. So why were you okay with sending them out like that? Like what motivated you to do that?
So for almost a month after I delivered, I kept my daughter home. But after that, when I resumed work, it was hard for someone to watch her all the time. As I said, I'm in a very small county in a small area. And at that point, there were maybe some 30 plus people affected with coronavirus. And this was a family based daycare. They didn't have really people visiting to New York City or areas, the hotspot areas. So it was reassuring that hopefully she wouldn't bring the virus home. And they followed all the like precautions in terms of hand washing.
Okay, so what would you like what advice would you give to like parents who live in like bigger areas and like they might not have the option of like sending to daycare, like how would you reassure them?
Unfortunately, for those kids, it would be best in the kids' interest and for the family's interest for them to stay, away from daycares. And it would be frequent hand washing, masking whenever it's feasible. Again, young kids, it's hard to mask them, but if they are comfortable, just to mask and avoid them taking in like crowded areas like malls or grocery for like supermarkets. Try to keep them in like zones which have less people. So a small playroom with just few people would be something would be ideal.
So how do you feel that with everything going on has affected your family dynamic and raising your children?
Uh, So, of course, now like I had like I was in two minds before even sending her back to daycare, but it was like imperative for me to send her given that I had resumed work. But we'd stopped meeting people, socializing. We just avoided all visitors for at least 8 weeks till our boys got vaccinated. And it would be just making sure whosoever was visiting us was asymptomatic and had not come across anybody who was positive for coronavirus. We really didn't travel, and we are actually still not traveling with the boys that far to areas like New York City or New Jersey, just so that the chances of them getting the infection lessen. And the whole thing with coronavirus, initially it was thought that children don't get as much; they were more like carriers. So it was more putting risk, adults, especially over the age of 60, with other comorbidities at risk. But now, with some cases showing, how kids have got this acute inflammatory reaction because of coronavirus, it kind of makes me nervous.
Yeah, I'm sure that a lot of other parents are feeling the same way because a lot of the things right now are unknown. That's why we have healthcare professionals like you there to make us feel safer. And do you feel that the newborn boys or anyone in your family has missed out on a lot of things because of the pandemic?
Definitely, especially socializing, it's a very important. I would say, especially for toddlers, my 2.5-year-old, I think it's a skill. So you need to step out, play out with other kids just for your own development. So that got restricted. So she was more homebound, and even though we do not promote a lot of screen time, at some point, we had to give in for her to watch a little extra TV. Uh, and yeah, I mean, staying indoor all the time does make you I would say irritable. Sometimes you want to do things outside because you don't know how to use your energy, and yeah, so it does it has changed our outings and things we would have done otherwise with our kids.
So you mentioned how like not being able to go outside and socialize can make you like irritable. So what did you do to like help like control your like irritability or your mood changes and like to de-stress from work anxiety?
I started reading some books, listening to music, started watching some old movies. So it was just trying to find time. I guess it was just we had to kill the time by doing something we enjoyed, and which we usually don't find time. So as I said, there was just it was two things at the same time. Not able to go outside was frustrating, but at the same time, we started doing things which we wouldn't do otherwise, like finding a new book to read or like catching up on old TV shows.
So there's like two sides to the story where it's like you might be more busy and your life might be more chaotic because of the pandemic, but then like you also have more time on your hands since like you can't go out and you can't spend time with people. So like what are your opinions on that? Like about there being like two sides to the story?
Uh, so I think we all have got a chance to slow down a little bit and think a lot, be more cognizant of our surroundings and things which we could do. Or maybe just slowing down the pace of life has helped us to rethink a lot of things which we take for granted, or even sometimes we just do a lot of things reflexively in a busy life. Now, just to think and reflect on our actions, uh, and appreciate small things, like even just not having to worry about wearing a mask all the time, because as I said, we live in a very small town, so we could go out for a walk and not have too many people outside. So it does not mean we have to always cover up ourselves, versus in areas where it was so bad that people would have to wear masks, but despite that they would get infection. And a lot of essential services were open in my area, so that helped. Even certain restaurants had opened up earlier, so they had dine-in options at an early stage. So those small things I appreciated of living in a smaller town.
Yeah. So what does a regular day in your life look like?
Uh, Usually we have an early start. Our day starts around 8 o'clock at work. So we wake up in the morning, we just put our little one to the daycare, then go to work. I see patients in the clinic until noon, and then at noon, just grab a quick lunch and then see newborns in the nursery, and then again go back to clinic. at the end of the day, I pick up my daughter. Once I'm done with the clinic, bring her back, just getting her, shower her, feed her, spend some time reading books or playing with her, and then putting her to bed. And then we usually go to bed around 9:30, 10. So yeah, that's what a typical day is.
Yeah, that's that sounds pretty busy, but you seem like you have it under control. So how else have you had to balance your work life and home life with everything going on? Like, have you had any extra help with you?
Yeah, so with my twin boys, my mom came to help me. So from India, so that was a big help. And like fortunately for me and unfortunately for her, she landed up staying longer, just because flights to India have been cut down, and there are just very few chartered planes going. And uh, it's busy, especially the days when we are on call. It gets busy with three kids. The house gets busy, and I just have to plan a lot ahead, organize my day in terms of what activities I would think for my daughter, and meal planning. And I was actually like breastfeeding, so I would have to pump in between every just time that in my routine. So that was additional responsibility, or like a chore for me. Uh, yeah, so just a lot of planning, which I have to do now.
So, how has having to take care of three children while having a full time job at a hospital during a global pandemic affected you mentally as well as physically?
Mentally, yeah. I mean, you look forward to at least stepping out once in a week with all of them just to get fresh air, and not able to do that sometimes. It does get, as I said, frustrating for a toddler to have that routine. Before that, she was used to going to parks, she was used to going to like some play dates. All that had stopped. So, and also for us, it was to deal with her tantrums because her attention was getting divided with the other two kids. So then she would have more temper tantrums issues. So we had to deal with that. Uh, but with, as I said, otherwise, it's not, we don't see so many sick kids. So our work life has been pretty much the same, looking, just seeing the well child and immunization, patients who require immunizations. So yeah, work life has been pretty much the same.
Okay. So, is there anything that you wish you had done differently? If so, what would they be?
I really don't know. As I said, I'm in an area where we don't have so much coronavirus. Uh, Only thing I think a lot of patients before this pandemic happened came with symptoms suggestive of cough, runny nose, and fever. If we'd known the extent of the disease, maybe would have tested them. We were testing a lot of kids for flu, but we would have probably tested them for coronavirus, and maybe that would have, help us found those cases earlier or detect them.
Is there anything that you wish was done differently by the country for our healthcare workers?
Uh, I think initially there was struggle having the personal protective equipments, which a lot of hospitals have now started providing. I think if we anticipated this as a problem, the testing could have started earlier, and even the social distancing. I think I know there were these hotspots, but then a part of country never followed those regulations. So I think that should have been stringent in those states. uh, yeah, that's what I think.
So, how has this pandemic changed your perspective on your job and what you do on a daily basis? Like, what motivates you to keep doing what you do and move forward as a healthcare professional?
I really appreciate the work put in by the emergency doctors, the intensivists, the nurses, uh, and even other staff that helps to run the show in the hospitals in the big cities, because they had like so many cases, and I could only imagine working day and night in those setup and looking at. I mean, there have been doctors who've written about how they've seen their patients dying, and how depressing was it to, come back home, but at the same time you want to help others, so that would motivate you to go back to work. But again, I mean, hats off to those of, frontline health workers. Uh, and as I said, I just feel very fortunate that in pediatrics we don't see so much. So I haven't personally come across any deaths or cases myself. So, but for those who've dealt with it selflessly, and some of them have even succumbed to the disease. So I think I really appreciate for what those guys have done.
Yeah, it takes a lot of courage and like just to go out there every day.
Right.
Um, so we've talked about the family dynamics, but what about like hospital dynamics? Like, has anything changed there, or has like the team and like the employees stayed the same?
No, in hospital, a lot of things have changed. So at a clinic setup, all patients are screened over the phone before they make an appointment. We did not see anybody with rash, fever, or symptoms suggestive of COVID. If they had any of those symptoms, we would do a telephone visit. They would come to the parking lot and they would get swabbed for coronavirus. We wouldn't see them, just so as to avoid exposure to the newborns who would come to the clinic, or even other healthy patients. And then in the hospital, so in hospital, everybody who steps in gets screened with those questions. And masking is compulsory for everybody, depending on what area you work. You're supposed to even have an eye protection. All the mothers on the obstetric floor, they were getting tested for COVID before they would deliver. At some point, they had even stopped visitors. Visitors are actually still not allowed, but the partner who would help them during the labor was not allowed to leave the hospital premises once they would enter. So that was something was new. Previously, everybody was allowed to come in and be out as needed if they needed to get something to eat, or to smoke or something. But all those restrictions had been applied. They had to be with the patient once they come in. They could not leave the hospital. uh, Hospital and clinics have started disinfecting areas after clinic areas. So after every office visit, the area would be cleaned, disinfected for the next patient to come. And as I said, we did a lot of telephone visits over the phone with the patients.
Those seem like really good precautions to take. And also to end, do you have any advice you want to share with us? Like maybe lessons you've learned, or ways that people our age can like help out? Because I know that a lot of people feel like they've not been able to do anything. So if you have any advice on, you know, what we can do to do our part.
So just follow simple precautions like hand washing and wearing masks. Uh, that that helps a lot in general from preventing spread of coronavirus. But hand washing with simple soap and water even like stops a lot of other germs from spreading. Lessons learned. So yeah, a lot of diseases are the new diseases are just not known to physicians. So it's a learning lesson for every doctor, every person here, to see how the natural course of this disease is progressing. So it's learning in its own way. Everybody's learning every day something new about this virus. At the same time, just appreciate the efforts put in by the doctors and the nurses in making our lives, I would say, safer when you actually need that care. And yeah, just live the moment.
Thank you so much for your time.
You're welcome. Thank you for interviewing me.